Now, cutting across to Kerala, Kerala seems to be slightly ahead of the curve. Despite a surge in cases, Kerala, even then, has somehow managed to keep in control the spread of the virus. In terms of their numbers, in comparison to other states, have been quite impressive. The death toll also has been quite in control in compared to the other states. But nonetheless, Kerala says it's not letting its guard down. Kerala, in the midst of this, becomes the first state to declare community transmission. In fact, even though they admit that this is community transmission, a second wave has broken out in Kerala, where they're seeing a spike in cases owing to the lockdown being lifted, an influx of people coming in through its porous borders, and the expatriates who have evacuated from various other countries and brought back on the Vande Bharat flights. Kerala is now looking at a surge in cases. In fact, officials say that the worst is yet to come. Kerala now is looking at a spike with the nationwide lockdown that's been lifted, and with people coming in into the state from various borders, they're looking at the number only on the rise. Kerala has largely stuck to its strategy, though, to test, trace and isolate. Even then, the numbers are on the rise. However, Kerala has reported over 13,000 odd cases and about 44 deaths. But in comparison to other states, Kerala indeed appears to be ahead of the curve. Now, what measures has Kerala really adopted, and how are they stepping up their fight, and what can other metros learn from Kerala? Let's take a listen. Let's speak here to Rajiv Sadananda, Chief of the Health Systems Transformation Platform and a Principal Advisor to Chief Minister Pinarayi Vijayan, to tell us a little more. Mr. Rajiv, why have you declared community transmission? Tell us on what basis have you declared it?
No, definition of community transmission is very clear. I won't go into that. But this is something that Kerala had anticipated. When you keep the curve low, and as the numbers keep going up, because you will miss cases anyway, and they will slowly start spreading in the community. And you're surrounded by other states that have high, prevalence rate, and Kerala has very close links with them. This cluster, with the large cluster which has come up in near Trivandrum, where the community transmission has been declared, was part of a part of the same same kingdom, of which Kanyakumari was also a part. So these two have been having social contacts for a long time, and that is how it has happened. And when the definition of a social of a community spread is where the known source of infecting a person is not known, and the infection would have come from the community. That's called a community spread. As the number of people whose infection Kerala could not trace, Kerala declared the community transmission, also sending a message to the people of Trivandrum that any person you encounter could be a source of risk. So the precaution that you need to take is universal. The purpose of declaring this was to ensure that the appropriate message goes to the population.
Right. Mr. Rajiv, it takes us to believe then in that case that the lockdown has been largely effective. Is it really, we're looking at a rise in cases because the lockdown has been lifted? Is that what you believe? Do you believe in a lockdown?
Lockdown, there's no belief or anything. When does a lockdown happen? When the cases are surging and when your health system is not adequately equipped to deal with it, you stop the process which spread the disease, which is social interaction. So as you cut down businesses, as you cut down travel, the possibility of the virus to get carried by human beings to another comes down. So the purpose of lockdown, or all that the lockdown could have achieved, and to some extent did achieve, is ensuring that the health system was able to increase its capacity to deal with the outbreak. The aim of managing a spread like this is always to ensure that your spikes are always kept below the surge capacity. So the lockdown achieved two things. One is it reduced the size of the spike, and two, it gave time to the health system to ramp up its capacity. So the possibility of the spike remaining below the surge capacity was enhanced. To that extent, I would say lockdown was successful, and that's the only thing lockdown could have done.
Totally. Absolutely. Mr. Rajiv, Kerala has been slightly ahead of the curve despite Kerala being the epicenter for COVID-19 cases right at the start that it broke out in India. From then to now, somehow you all have managed to contain the spread. Now, what should other metros really learn from Kerala's strategy?
Other metros have gone before us and have done lots of things, which actually we have to learn from. Kerala's strategy is basically threefold. One is pick up a cluster before it becomes, the disease becomes widespread. So for that, what is being done is identifying populations that are of high risk because of the occupation, because of the interaction, and keep doing sentinel surveillance using antigen to pick up cases. And where the cases are picked up, widen the net. Second one is where you have, as I mentioned before, where you have picked up the infection, ensure that it is contained as best as possible. For that, once an infection is picked up, you test as many people as needed, the contacts, secondary contacts, and so on, and ensure that the people who are infected in the community are picked up and further spread is prevented. Third one is reducing your case fatality rate. Ensure that all the people who test positive are provided quality treatment, and danger signs, red flags are picked up in advance, and mortality is prevented. Within this is the other agenda of ensuring that the vulnerable population, that is the aged, the people with comorbidities, are shielded and and tested adequately so that they are protected from infection.
Right. Thank you very much, Mr. Rajiv, for joining us and giving us those details. Kerala indeed being a little ahead of the curve. In fact, drones are currently being used in Kerala to monitor those jumping. And we're looking at a significant, very glaring shift of the coronavirus positive cases moving from elite town areas to now into the suburbs. Kerala there preparing itself.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.